Well, as the number of coronavirus cases steadily increases in the country, India's private sector and private citizens are increasingly of the impression that before the healthcare system gets completely overwhelmed, it is up to individual experts to offer their services in as organized a manner as possible. And we've spoken to India's first private task force, presenting India's first private citizens from IIT and IIM from across the world who've come together and told the government, please use us.
India stands on a terrifying threshold. As the number of coronavirus cases steadily marches on, the country has a choice. Either we fight it back now or the system gets overwhelmed. In a country of 1.3 billion people, you know what that means. But as the government accelerates the fight, private citizens are organizing themselves to pitch in if needed. Presenting India's first private citizens task force that brings together over 100 IIT and IIM graduates, collaborating from across the world to offer their services to the Indian government. The initiative began 5 days ago and already has over 200 collaborators offering expert-level services that can be utilized. People who have taken time off to immerse themselves in India's fight.
The doctors on the front line were facing a huge shortage of basic protective equipment, and we needed the help of techies to better serve our country. Within 24 hours, over 100 people from IIT, IIM and diverse backgrounds joined us to help.
Spread across the world, this team of experts is offering to solve multiple issues quickly, including frontline equipment shortages like face shields to help forecast demands and manage resources, analyze the masses of data quickly to preemptive action, organize community initiatives in non-metro cities, critically solve ventilator and thermometer supply chains, and of course, telemedicine. The combination of healthcare and tech could be a formidable weapon in India's fight.
I'm helping to fight COVID-19 in India by using data and analytics. The initiatives that we're working on range from ensuring that people who've identified positive for the disease get to the closest quarantine centers and isolation centers which have been identified by the structural engineers.
Vasudha, for instance, with over a decade of academic and real-world experience in analyzing customer behavior, is prepared to analyze data to help fighting the disease. Sumant Bhatoria is contributing to the COVID-19 crack team with 3D printing expertise. He already has experience in making basic protective equipment like face shields and making hand sanitizers. Rohit, an IIT and IIM graduate, is working with healthcare providers to address need-of-the-hour problems in the battle against the virus. Sudarshan Gopalan heads a design-led tech team that wants to make headway into a community-driven design effort with tech-supported delivery of solutions organized by the government. Anita is a soft-skill behavioral trainer and HR recruitment consultant who will look to create career solutions in a national picture. The team, spread across the world, isn't arbitrary and is interfacing with the government, both in Maharashtra and at the center, to offer its muscle.
Collaboration and a multidisciplinary approach is the only way we can beat this threat, and I would request political leaders and industrialists to join us to implement some of these brilliant solutions by India's smartest and finest.
As the government fights to ensure coronavirus and COVID-19 don't overwhelm India's healthcare system, will too be imperative for the system to enlist India's private crack teams, like this one, to fuel the fight.